Coronaviruses are a large family of viruses that cause illness ranging from the common cold to more severe diseases, such as Middle East Respiratory Syndrome and Severe Acute Respiratory Syndrome. Coronavirus disease is a new strain that was discovered in 2019 and has not been previously identified in humans. Coronaviruses are zoonotic, meaning they are transmitted between animals and people. Detailed investigations found that SARS-CoV was transmitted from cats to humans and MERS-CoV from camels to humans. Several known coronaviruses are circulating in animals that have not yet infected humans. COVID-19 has become more dangerous due to its ability to spread rapidly even though it has a low mortality rate compared to other fatal infections happened in the past. 1. It will first infect the throat, so you'll have a sore throat lasting 3/4 days. 2. The virus then blends into a nasal fluid that enters the trachea, and then the lungs, causing pneumonia. This takes about 5/6 days further. 3. With the pneumonia comes high fever and difficulty in breathing. 4. The nasal congestion is not like the normal kind. You feel like you're drowning. It's imperative you then seek immediate attention. Standard recommendations to prevent infection spread include regular hand washing, covering mouth and nose when coughing and sneezing, thoroughly cooking meat and eggs. Avoid close contact with anyone showing symptoms of respiratory illness, such as coughing and sneezing. The new coronavirus may not show sign of infection for many days. How can one know if he/she is infected? By the time they have fever and/or cough and go to the hospital, the lung is already fibrosed and it's too late. Taiwan experts provide a simple self-check that we can do every morning. Take a deep breath and hold your breath for more than 10 seconds. If you complete it successfully without coughing, without discomfort, stiffness or tightness, etc., it proves there is no fibrosis in the lungs, basically indicates no infection. In critical time, please self-check every morning in an environment with clean air. Serious excellent advice by Japanese doctors treating COVID-19 cases. Everyone should ensure your mouth and throat are moist, never dry. Take a few sips of water every 15 minutes at least. Why? Even if the virus gets into your mouth, drinking water or other liquids will wash them down through your throat and into the stomach. Once there, your stomach acid will kill all the virus. If you don't drink enough water more regularly, the virus can enter your windpipe and into the lungs. That's very dangerous. 1. If you have a runny nose and sputum, you have a common cold too. Coronavirus pneumonia is a dry cough with no runny nose. 3. This new virus is not heat resistant and will be killed by a temperature of just 26-27 degrees. It hates the Sunday 4. If someone sneezes with it, it takes about 10 feet before it drops to the ground and is no longer airborne. 5. If it drops on a metal surface, it will live for at least 12 hours, so if you come into contact with any metal surface, wash your hands as soon as you can with a bacterial soap. 6. On fabric it can survive for 6 to 12 hours. Normal laundry detergent will kill it. 7. Drinking warm water is effective for all viruses. Try not to drink liquids with ice. 8. Wash your hands frequently as the virus can only live on your hands for 5 to 10 minutes. But a lot can happen during that time. You can rub your eyes, pick your nose unwittingly and so on. 9. You should also gargle as a prevention. A simple solution of salt in warm water will suffice. 10. Can't emphasize enough, drink plenty of water. Deaths from COVID-19 are due to 1. Cytokine storm syndrome and 2. Fulminant myocarditis. During a cytokine storm, an excessive immune response ravages healthy lung tissue, leading to acute respiratory distress and multi-organ failure. All COVID-19 patients sick enough for hospitalization should be given a serum ferritin blood test. Elevated serum ferritin values are a good first screening tool for the possibility of a cytokine storm syndrome in sick patients with high fevers. Treating COVID-19 infected patients with cytokine storm syndrome with IL-6 blockade, tocilizumab, has recently been reported in China with successful outcomes. Fulminant myocarditis has also been reported in patients with COVID-19. Fulminant myocarditis is primarily caused by infection with viruses. It arises quickly, progresses rapidly, and may lead to severe heart failure or circulatory failure presenting as rapid onset hypertension and cardiogenic shock, with mortality rates as high as 50% to 70%. Physicians should pay attention not only to the symptoms of respiratory dysfunction, but also the symptoms of cardiac injury.